everyone. I'd just like to welcome you to today's session. It's 12:30, so we're going to kick off. I'm Sarah, and I'm very proud to be Chief Executive of Hertfordshire Independent Living Service. Now, this is a very special week for us at HILS because it is National Meals and Wheels Week, and that is a time when we have an opportunity with partners to celebrate the fact that we have the most amazing Meals and Wheels service in Hertfordshire. It is the largest service of its kind in the country, and each year we're able to support 15,000 people with a whole variety of different services. Now, one of the great things about Meals and Wheels is not only that we can help people with their nutrition, make sure that they get food that's really good for them, that they can enjoy. It's also that we are able to help them by putting them in touch with other services. Our teams who go out each day get to know our clients incredibly well. And that means that they can spot if something happens, if the individual is not very well, or if they have a problem, or even perhaps if they have a growing problem with their memory. And of course, early memory loss and dementia is a growing problem amongst older people in particular. And we come across cases of people struggling with their memory and with dementia each year. And we're able to signpost them to services that can really help and support. Well, one of the most amazing services that can help and support with dementia, both family members and someone who is living with it, is Hertswise. And that's the service that we're very, very proud to tell you about today. So in a moment, I'm going to introduce you to my wonderful colleague, Sam, who will explain more about the service. But before she does that, I would just like to say that this is also the most fantastic example of partnership work. Because to really meet people's needs in the community, we have to work together across systems and across sectors, all of us pulling together to try and provide services that really help people at a time when they need it. So I hope we also have other partners on the call with us as well, partners from HUK who lead on this programme, but also from Carers in Hearts, from Hearts Mind as well. So lots of colleagues who come together to help, and HUK Decorum colleagues too. So we're going to hear more about it. Sam will explain the programme to us. If you have any questions as we go through, do put them in the chat function, and then we'll have a time of questions and answers afterwards. So Sam, I hope that we can see you, and we are over to you to hear more about this service. Thank you.
Thank you, Sarah. So, hi everybody, my name's Sam Dukelow. I am one of the team leaders for the east of Hertfordshire for Hertswise, and I'm also the locality worker for St Albans. So let me just share my screen. Okay, so hopefully everyone can see that okay. So Hertswise is a service for people primarily living with dementia, but it's important to note that we support people with or without a diagnosis. We're very aware that some people choose not to get a diagnosis, or for various reasons, there is still a stigma, unfortunately, attached to dementia, choose to receive support without a diagnosis. As well as people with memory loss and mild cognitive impairment. And among our community groups and various support, we also support next of kin and carers as well. And we work in partnership with Carers in Hertfordshire to support those carers and family members. So as Sarah mentioned, we are a service provided by a big partnership of organisations. I have all of our logos on the next slide, and I'll discuss what all the different organisations do a bit more. And of course, we're here to support and empower people to live well. We're not here to determine whether people live well or not with dementia. We're here to provide the right tools and support to enable people to live as well as possible and deal with any struggles that they may face, but be able to live well and independently in the community, as we are a preventative service to prevent carer and clients from breakdown and reaching out to crisis support. So this was created at the start of the partnership in 2017, just to outline how referrals are done throughout dementia support in Hertfordshire. So at the bottom level of the community support, that's where we run our community groups, we provide one-to-one support, carers in Hertfordshire providing much support as well. And this is where we bring in the knowledge and wealth of experience among the partners in to support people in a timely way, and as and when support is needed. And at the bottom, all of the logos there, that is the HILSwise partnership. And they bring together all of their expertise to provide clients with various support required. So we have an open referral process. People can self-refer. We receive referrals from professionals. From, for example, the HILS drivers going out on their rounds, they'll come back and report to their team leaders and they will get in touch with us. So anyone and everyone can refer in for information and support from HILSwise. Further up the pyramid, as you can see, it outlines the Alzheimer's Society. We work very closely in partnership with the Alzheimer's Society, with their dementia support workers and their dementia advisors across the county. And we are able to refer in a streamlined process as we use the same database, so that clients and carers only have to tell their story once. That was a really important thing at the start of the partnership, as we use Hearts Help as the main referral telephone number. And we don't want clients and carers telling their story half a dozen times, almost not wanting to bother to ring half a dozen telephone numbers. So Alzheimer's Society and various organisations, we're able to use the same referral process. And of course, when people do refer in, they use Hearts Help and Hearts Help alone, and hopefully they only have to tell their story once. As I mentioned, we are a preventative service, so we aim to keep people happy and healthy at the more community level of support, but we also work with Dementia UK and Carers in Hertfordshire, as we have Admiral nurses in the county. I would quote how many Admiral nurses there are now, but I can't recall, because what was really great is that they were able to get more funding to have more Admiral nurses across the county, as we're quite fortunate in Hertfordshire. Some counties don't have any, they may only have one or two, but we're fortunate to have a team of Admiral nurses, and they are there to support carers at risk of crisis point or maybe reaching crisis point, to look after their own health and well-being, as we find that quite often carers put their health second, and always supporting their loved ones and the person living with dementia. So we work closely with carers in Hertfordshire to provide a lot of support, as well as the Admiral nurses for carers. And hopefully we are preventing clients and carers reaching emergency crisis point support. So prior to COVID, I thought I'd distinguish the difference in our support, both prior and currently. So with the HILSwise partnership, we have a locality worker such as myself for every district in the county. And this means that we have the localised knowledge, we have local contacts and networks with other professionals that we can provide relevant and specific support. So our community groups run across the county, and we aim to have the knowledge to be able to set these up where there is local demand. We're not just trying to pick various locations, we're looking at client need and client demand for these community groups. The young onset specific support, we have 2 young onset locality workers that are reaching a lot of people, anyone under the age of 65 that have young onset dementia, and unfortunately they are supporting people in their 30s that have dementia as well. So it's really needed that we have the young onset dementia support workers, the locality workers. Along with our community groups, we provide one-to-one support, and this was in-house visits whereby we would visit weekly. The aim would be to be able to encourage and provide confidence for individuals to come out to our community groups. If it wasn't our own community groups, we would look at signposting them to the right groups or activities for them out in the community group, out in the community. It may be that we would assist them to reach out to any other groups, but just give them some support to be able to initially attend to these groups, and then we step back, having provided them with the right support to then set this up more long term. So the one-to-one support was between 6 to 10 weeks, and then we would ensure that there was then support provided ongoing. Carer supports provided by carers in Hertfordshire. We have a carer support worker who provides a lot of groups across the county for carers, and providing training and knowledge for all these carers to be able to support people living with dementia. With our training, we provide dementia awareness training, and this is open to anyone and everyone. So we have provided our training workshop to GP surgeries, U3A groups, yoga instructors, other day centres and community groups. So our training is there and open to everyone. We have different options of that. We have a 3-hour workshop and a shorter workshop as well, which we try to tailor around what the group want out of the training, and all of the locality workers aim to deliver this locally in their district. As part of our role, all of the locality workers are always networking and developing relationships with other professionals in this industry. So we often attend other meetings and other events to provide talks and share information at different events. As I also said, signposting is a massive part of our job. If it isn't our support that's most relevant, we will aim to look at the right support for the individual, whether it is other local groups set up and other contacts that we can refer to. Our information and advice team, as part of Age UK Hertfordshire, they provide various information assistance with applying for benefits. I do have some figures a little bit later into the presentation, but they will assist with looking at setting up lasting powers of attorney, applying for attendance allowance, support with blue badge applications as well. So they're there to help with any information that people may need to be able to get the right support for them. So this video, I'm going to show you a short video now as part of the HILSwise partnership. This was developed last year and gives us a real nice snapshot as to what we were doing prior COVID.
A lot of people, when you get in these groups, seem to feel as though they've known someone before they even meet the people. It's such a friendly atmosphere.
When you get to know them, you realise you're not on your own.
If someone's new, we do go and have a chat with them at least, you know, so if they don't feel isolated.
Nearly every single person I met that's come along has been surprised by how much they've really fallen in love with the group, with the people. It's like we have our own little family, and there's always someone there you can talk to and get support from.
Carers are supporting other carers, clients build new friendships, whereas their previous friendships may have broken down because being diagnosed with dementia may create a distance with some friendships.
There's still a massive stigma attached to that word. People are really afraid about discussing it.
I like to greet people when they come, new people, you know, and introduce them round. And if at the end of our meetings, you see everyone going out smiling, I say, I've done my job. It's not my job. I mean, I do have dementia. Personally, I will help any way I can to keep it going while I'm still capable of doing it. If you can come out, you can enjoy yourself, you can have a laugh. Whatever state you're in, you can really enjoy it, whether it's sat down in your chairs, dancing, exercise, cricket.
We've done quizzes, we've done reminiscence work, we do a lot of chair-based exercise.
Armpit fudge, karate, dancing.
We'll bring in dogs, yoga teachers, we'll bring in speakers around trading standards and scams.
The things we do are quite good, actually.
Puzzles and games we played, which I think a few of us have actually gone and brought. We've got them ourselves at home.
It's very difficult to keep someone occupied. Doing things like this is stimulation, and that's what's so important.
It's nice coming to groups like this because you meet other people in the same situation that I'm in,
I find out more from coming to these groups than any professionals bother to tell you. If you want to find out where you can get services, you have to find out all those things yourself. But when you come to these sort of groups, there's other people that have already been up that road.
My actual role here as a volunteer is mainly to make sure they leave with a smile on their face. The real person's still in there. If you can make them happy with a smile and a little joke, away we go. The unfortunate part is I lost my wife a couple of years back, but in that meantime I go out 3 times a week volunteering. I think that what I do may not seem a lot, but what else would you do? The real person's still in there. It's just accepting the fact that that's who they are now.
All right, people do pass on, and it's a shame. But this is something to keep you going and enjoying it. And I can't think of anything else to say.
Professionals do provide a lot of information, but I think Terry refers to that it's completely invaluable what carers share among themselves, the living experience, and they have those few hours to then share their experiences and get help from others going through similar experiences. And as you can see from that video, some of our clients are real advocates for the service, and it's really lovely that friendships are made in our groups. And even when, unfortunately, we do lose individuals, carers have those relationships there, and they still continue to return to our groups even after a loved one has passed. Our carers have gone through such a journey with their experience with dementia, and those friendships have been invaluable during those years and months. So our current service, we are providing weekly Zoom calls. So we have managed to get quite a few of our clients onto Zoom and using technology. We've been able to get funding and provide some technology and iPads and tablets to clients as well, and give them training. So it's been really lovely to see so many of our clients accessing our Zoom groups. We've been able to host at least one Zoom group for every district in the county. Fortunately, we've had more than that as well, as there has been demand for our Zoom groups. Weekly welfare calls. So for some individuals that may live alone, or some carers particularly going through a hard time, these calls have been a few times a week. For some of our clients, it's been really lovely to hear that actually they're getting on well, and we've been providing calls every few weeks. So this has been really person-centred as to what people have needed during the pandemic. In the sunnier, warmer months, we were providing garden visits, and with everything, all safety measures in place, we've been able to have some lovely garden visits with our clients. And then in the last few weeks, we had started to do one-to-one home visits as well. And fortunately, with the right things in place, hopefully we are going to be able to do essential visits over the next month for those that have particular difficult times. From March as well, we've been providing monthly entertainment packs to all of our clients, and any new referrals as well. We've been providing quizzes, word searches, useful information to have a read at home. So this has been keeping some people busy at home and giving them activities to do together as well. So if people have been living with family members or sons and daughters, even grandchildren, have been able to sit and do some of the quizzes and activities together. At the start of the pandemic, all services pulled together, and we were ready and available to support any other service among the partnership and provide shopping and food parcels. So this was primarily for our own clients, but we were also there to receive new referrals to get shopping prescriptions to many of the client base. If they were shielding as well or not confident to go out, we were getting this done for them. A lot of signposting has, of course, been going on, as unfortunately carers have been struggling a lot during lockdown without having regular respite and these community groups happening. There's been a lot of difficulties for many of our clients and carers, and they're all doing amazingly, but we've been there and been the eyes and ears as much as possible to be ready to make these referrals, or if there are concerns or safeguarding issues, we've been able to pick these up as much as possible during this time. And of course, we've been still working closely with dementia support workers at the Alzheimer's Society and at the Admiral Nurses as well. A few photos from the garden visits, which we are now. I'm very much missing the lovely weather we had. So these stats, just to give you a snapshot into the last financial year and how we supported people. So as you can see, for some of them, we surpassed our targets and our KPIs, and we're able to support a lot more than what was initially anticipated, which is lovely to know. The £1.4 million obtained in benefits from our information and advice team is pretty amazing, but that's all attendance allowance, some different disability benefits, anything that they've been able to obtain for clients. So, and that's just our HILSwise clients as well, so that's pretty amazing. With our home visits as well, there will be short-term visits as well, so we've been able to support many people with those. And some stats for during COVID as well. As you can see, some are quite substantially different from the last financial year, but actually we're still reaching out to tons of people, and this isn't even a full year of stats yet. The carer supported 509, and I'm sure this will go up, but our carer support worker, there's one of her, and the Carers in Hertfordshire team, but there's one of her in our HILSwise partnership, and she's doing absolutely amazing to reach out to those carers as well. And of course, our regular Zoom groups, where we've been able to get anyone onto our Zoom sessions and using technology. It's been brilliant to have weekly quizzes, music, exercise sessions via our Zoom sessions, and a staggering number of people attending those as well. This was just wanted to share some images. This was a holiday themed activity we reminisced. Clients bought holiday photos in and shared stories from holidays, and they were talking about Butlins and holiday camps. So the gentleman done knobbly knees competition, which was very enjoyed. And of course, we do a lot of themed activities at our community groups as well. Okay, so that's everything from me. I'm going to stop sharing, and I believe we're going to go back to Sarah, ready for Q&A.
Wonderful. Well, thank you so much, Sam. I mean, what an inspiring presentation to hear all the incredible work that's been going on, serving so many people across Hertfordshire. And it has been a very challenging time, of course, trying to make sure that our services are safe. And the good news is that at the moment, we're looking at how we're going to be able to re-establish safe group meetings. Of course, we have to do it in a different way at the moment, and finding venues has been a real challenge for us, but we're going to be doing that as well so that we can get people back together, meeting physically, if that's the right option for them. Now, please do put any questions that you have in the Q&A or in the chat, and we will take those. But whilst I'm waiting for questions to come in, Sam, if I could ask you a question, please. I just wonder if you could talk us through particular issues that you have found that have been real problems for people during COVID. So what are the particular things that you've been trying to deal with along with your colleagues?
So it has mainly been a lot of carers support and emotional support, because their lack of structure, their normal routine, and their ability to go out for a few hours. Carers don't want a lot, but those few hours just once or twice during an entire week to themselves is always so vital for them, just to have some time to themselves, relax, do something for themselves so they're ready to care for their family member or loved one. And having that option and choice taken away from them, I think, has been a real challenge. And we've been having quite lengthy telephone calls just for carers to be able to have a vent, have a cry, talk through struggles. And for us, we've never been that level of support at our community groups. It's always been a lot lower level of support, and having to support clients through these times has been real challenge hearing their struggles, because you just want to help them. And then for a lot of our clients, the social stimulation interaction that they have with other clients has really been a real struggle for them, and having to deal with struggles with their dementia. A lot of them are experiencing depression as well on a complete separate level, and the lack of social interaction with a particular client, he has found not going to groups has really impacted him, and has had to seek advice around depression because he doesn't have that interaction.
Thank you, Sam. So that's why it's so important that we do carry on having face-to-face visits for people who that it's appropriate for. But obviously a lot of challenges for you as colleagues as well. And I know there's been lots of support for both staff and also for residents as well, dealing with mental health problems as a result of the crisis. We just had a question from one of our colleagues who works for the Hospital Community Navigation Service, asking about how they can refer into the service, whether they have to go through Hearts Help or whether they can refer direct. So maybe you can tell us about that, Sam.
Yeah, so as I mentioned, Hearts Help is our single point of access telephone number. So if you speak to members of staff at Hearts Help, they will be able to send a referral in via our database. We do have a member of staff there. I know there's been a member of staff change around, but there is someone there that can refer directly on our own database that we use. So they should be able to get in touch. But if you're ever unsure, I know some other professionals and staff out there may have the direct number for their locality worker. So if you do want to contact the locality director direct and you have their contact number, that's absolutely fine. But yeah, if you speak to the Hearts Help staff, they'll be able to make the referral straight to the right worker.
Thanks, Sam. And obviously it's really important that we get help for people quickly. So if you're ever worried about anyone and you think that they need urgent help, as Sam says, do feel free to pick up the phone. And if you don't know who your locality worker is, we'll always cross-refer across the system. So call any of the partners and we'll make sure that you're put through to the right person. Well, that's great. So Sam, can I also ask you about how you have managed to support each other as team members? Because of course, it's also been very important that you've been able to stay connected. Working across a partnership has its own challenges. How have you been able to support each other during this time?
Yeah, so we've been at the start of the first lockdown, we were having weekly Zoom calls, and this wasn't necessarily work related. We were just doing some fun quizzes, having a chat about people's weeks, just keeping a really informal Zoom session there every week for staff to jump on if they wanted to, have a catch up with each other, because our job usually is very sociable, so we're always interacting with each other and seeing each other. So going from that to then obviously being at home all week, we just wanted to make sure that we had the time to chat and have a catch up, and across the whole entire team as well. We had our own team Zooms, but we also had our county-wide team meetings whereby we would do various quizzes and activities as well. And quite recently, a few weeks ago, the East team, there's a team of 6 of us, we met up socially distanced, perfect number, the 6 of us, socially distanced in a park and done some physical activity. Done some exercises in the park together as the first time in 7-8 months of seeing each other. So that really helped some of the team.
Wonderful. So just as a sort of a final thought until we have any more questions, what advice would you give then for us as professionals, but also for us as local residents who may come across people who are starting to worry about their memories? What advice can we give to people at this very difficult time? One, about staying well, but also about where to get help if they're struggling.
Yeah. I think it's hard because as soon as you mention the word dementia, a lot of people will be like, no, I don't need that. But actually, even when you think about mental health and the symptoms of depression and anxiety, memory loss is a symptom of that. So actually having those open conversations, just being like, the last few months have been tough for everyone. It may not be that your memory loss in recent months is because of dementia, but just as a reassurance, would it be reassuring for you to reach out and speak to someone about your memory loss? It may be something simple and something you may just need a bit of help with short term that can improve that. But if it turns out that it is something that they do need to get tested for, and there is a possibility that they have dementia, at least then they've reached out for some support and information. They may then be more likely to incline to accept help. And of course, it doesn't just have to be that they have dementia. If they want to do something to promote their physical and mental well-being, then try and reach out to anything available to them, just to keep well and stimulate their memory. Is there I'm just reading this question.
Sorry, we all want to be helping and working together, and of course there is an opportunity for us to work with health colleagues as well. We just had another question coming through saying, is there a direct link with GP services? Because obviously that's very important, because there wasn't one back in 2013 when the person who's asking was saying that that he was a carer. So do we have a direct link in? Are we able to refer into health services?
So we've spent a lot of time reaching out to GPs and the carers champions in GP surgeries to make them aware of the service, and we make it very clear that they can refer in themselves, contacting Hearts Help. But the strongest link that we'd have with GP surgeries is that there are GP link workers and the hospital Home from Hospital Community Navigation Service, and a lot of their workers having contact with GPs and looking at services out there. We hope that they are our main link to get this information out there. And as being a locality worker, we do aim to contact our local GP surgeries to make our services aware. And I know last year we actually had our information on the GP screens as well in the waiting areas. As we said, 9 times out of 10, if carers are going to GP surgeries, that's where they need to find the information. So it was also on the GP screens as well. I hope that helps in answer your question.
Thanks, Sam. And I think that's really important to know, because I think for all of us, it's very frustrating when we are treated as a separate case each time we have to speak to someone about a problem that we have. And it's great to hear that genuinely this service is helping all of the support that people need to join up around them, health services and others included. So I think I just have one other question. Sorry, I need to put my glasses on. Yes, to say that we're going to be sort of drawing to a close now, but if you do have any other questions, then do send them through to us, because we can certainly answer them outside this this session. So just wanted to say a huge thank you to everyone for attending. An enormous thank you to Sam for a very inspiring and informative presentation. Thank you so much for joining us, everyone, and we really look forward to working with you in coming months as we work together to try and improve people's lives. Take care. Bye.